What is the future role of AI in bile duct cancer?
We use our AI approach and we find some interesting correlations between the histomorphology signals with their biomarkers, essentially some genetic variations that have clinical implications, such as, say, EGFR mutation, BRAF mutation, and so on. And because detecting those mutations can help us decide whether this patient will likely respond to targeted therapy or not. So we train our machine learning model to recognize such signals using the samples collected for pathology evaluation. And we only use the whole side image, and we show that there are several consistent signals predictive of such mutations. And this has many clinical applications. For example, we could potentially give the patient the right treatment on the spot when we collect their biopsy samples, because based on this prediction, we don't have to wait for the genomic testing result, which could potentially shorten the time that patient is waiting for their final confirmatory molecular report and initiate the right treatment on the spot. And some other application might involve like expanding into the low resource regions where the genetic sequencing facilities are not available to most patients. And we could potentially use the AI augmented diagnosis to figure out the right treatment for the patient.
How can AI help reduce racial disparity in cancer treatment?
AI could be a low-cost approach to democratize diagnostic expertise. So in a sense, AI can help reduce the disparity by providing expert-level diagnosis to all patients, not just patients who are privileged and who have the resource to go to the top medical center in the world.
What is the danger of AI when it comes to cancer diagnosis and treatment?
Because most of the existing data that AI companies or researchers use are from the majority populations. And when they train a model based on such population, it may not be applicable to all populations. So in a sense, we might be actually aggravating health disparity if we're not careful enough. And if we just assume the AI model is a one-size-fits-all model and apply to everyone, then for the minority population, they might be harmed by having the wrong prediction, and that would affect their later treatment and health outcomes.